But you see, for us, we are seeing the mpox as a national outbreak. So we are not looking at it by region. You see, if you look at by region, then you see that this region doesn't have mpox. And you may lose your guard. No. What we are saying is that we have an outbreak of mpox. It's spread by contact. When you are in touch with somebody who has the rash, the contact could be direct or indirect. When I say direct, it means that it's a physical touch of the skin between two persons. So let's say if I hug you, or I kiss you, or I touch you. So this is a physical contact between two skin surfaces. Then you can also have indirect contact. That is whereby you are using somebody's towel, somebody's sponge, or you are sleeping on the same bed with a person who has mpox. That one is an avenue that you can also get mpox. So that's one way that you can get mpox. And the idea is when you avoid this contact, you are not likely to get the disease. But I think that I want us to move away from monkeypox and to mpox. But for 3 years now, we move away from monkeypox to mpox because it was giving a lot of stigma. So now the WHO says that the disease is now mpox. It is the same disease, but it's a different name.
Can it be fatal?
Yes. So in Ghana, 2022, we had 120 cases and 4 died. But for 2023, we had 8. Nobody died. 2024, we have 5. Nobody died. And this year, we got 117. There's no death. You see, what is happening is that it's a self-limiting disease, meaning that based on your immune system, you can get it, and then it can resolve on its own. So it's not curable, but it can go on its own. So what you do is that you try to make sure that you report early, and then you prevent complications so that you don't have fatality. If you look at globally, I would say averagely, you will see fatality about 10%. And then it all depends on how early you go to the hospital.
I see. But you said it's incurable?
Yeah, what I'm saying, so it's like when we are treating you, we treat you by the symptoms. So it's not that we are giving you the medicine that will say we are taking care of the virus. So we treat by symptoms. So if you have fever, you do something to relay the fever. If you have, let's say, headache, you do something to allay the headache. Normally, we try to make sure that the ulcers or the rashes are kept clean so that we don't get bacteria infected.
See. Let me conclude then by asking you what your advice is to the person listening to you this morning. What do we do to avoid contracting this that you say is spread through contact?
Okay, so the message is we have gotten a disease called mpox. Looks like chickenpox. But for a lay person, you cannot be sure whether it's chickenpox or mpox. So if you have a rat, you are saying go to the hospital. That's one. 2, you need to avoid contact with persons who have these rashes. And when I say avoid contact, it's like others, it's a direct contact or indirect. So when it's direct, it's a physical contact, skin to skin. So it's like hugging, shaking, etc. You see, let me put this point here. There's the impression that mpox is an STI, sexually transmitted infection. No. And then you see, when there's sexual intercourse, there's physical contact. So that's how people get mpox when they have sex. But it's not that it's the sex which is transmitting the infection. So it's very important. That's why if you look at these current cases, there are a number of cases that somebody's sexual partner is gotten it, whether it's male, female, or male. So that's one way. The another way is the indirect. You have to avoid carrying beddings. As I said, soup, towel, sponge, and then bed sheet, and actually sleeping together. No, you need to avoid that close contact. Then what you want to do is that when you have the rash, don't just go around mixing with people, touching, doorknobs and things like that. Go to the hospital, and then you'll be given some medication, and then you stay at home. For Ghana situation, as of now, nobody's on admission. So we are getting the mild cases. We don't want a situation whereby maybe your immune system is low, and then you get an mpox and you may die. So those people are not dying. You should know that they can tell. That's the first one to say. Let me give my last statement. You see, there's vaccination for mpox, but globally it's limited. So vaccination is restricted to a few key populations. So like health workers. But if a health worker and you are well protected with PPE, you are not at risk. Then two is persons who have been exposed to the virus. They are also persons that you can give them vaccines to. Then people who are the key populations, people who like men with sleeping men, people who have multiple sexual partners, they are key populations. So that's what countries try to see whether they can get the information. But then without vaccination, you can also address outbreak.
Well, thank you. Thank you very much, Doc, for speaking to us.
Thank you.
Yeah. That's Dr. Franklin Siribekwe, who is Director of Public Health, Ghana Health Service. So please do note the cautions he's giving. Key is contact. But secondly, do not, when you see, oh, this is chickenpox, no. Because of the era we are in, if you see those signs, that gives you the impression, tell you chickenpox, take it to the hospital, let them rule out mpox. Let them rule it out. Very, very important. SM.
Yeah.